Have you ever walked out of a doctor's appointment and suddenly remembered all the questions you forgot to ask? Or maybe you've sat in that exam room, feeling rushed and overwhelmed as your doctor rattled off information faster than you could process it. I know I have. And it's incredibly frustrating. Hi, I'm Dr. Sarah Chen. Before I became a physician, I was just a terrified daughter sitting beside my aging father during his appointments, watching him nod along to everything his doctor said. Even though I knew he couldn't hear half of it and understood even less. That experience changed everything for me. It showed me that the gap between what happens in a medical appointment and what patients actually need is sometimes dangerously wide. Let me tell you something that most doctors won't admit publicly. A typical primary care appointment lasts just 15 to 20 minutes. That's it. In that short window, we're expected to review your history, discuss your current concerns, perform any necessary exams, explain our findings, create a treatment plan, and answer all your questions. It's nearly impossible. This isn't just a time management issue. It's a potential health risk. Studies show that patients forget approximately 80% of what their doctor tells them during an appointment, and nearly half of what they do remember is remembered incorrectly. Those aren't just statistics, they're missed opportunities for better health. I remember Mrs. Rodriguez, an 82-year-old patient of mine, who came in for routine follow-up. For 3 consecutive visits, she complained about dizziness. But because she always mentioned it at the end of our appointments, almost as an afterthought, we never had proper time to address it. When she finally came in specifically for that issue, we discovered her blood pressure medication was twice the dose she needed. She'd been suffering needlessly for months. Preparation isn't just about being organized. It can be the difference between getting the care you need and falling through the cracks. Before you even schedule an appointment, start by gathering your medical information. This seems obvious, but you'd be surprised how many people walk into appointments without basic knowledge of their own health history. First, create a master health document. This doesn't need to be fancy. It can be a simple note on your phone or a small notebook dedicated to your health. In this document, keep a list of all current medications, including over-the-counter drugs, supplements, and vitamins, your vaccination history, major illnesses, surgeries, or hospitalizations, any allergies to medications, family health history, especially conditions that run in your family, the contact information for all your healthcare providers. I had a patient, John, who created what he called his medical passport. A small binder with all this information, plus a section for questions and notes from each appointment. When he had a medical emergency while traveling, that binder made all the difference. The emergency room doctor told him it saved hours of guesswork and possibly prevented medication errors. For seniors especially, having this information readily available isn't just convenient, it's crucial. As we age, our medical histories become more complex, and the chance of seeing multiple specialists increases. Being your own information coordinator becomes vital. Now, let's talk about identifying exactly what you want to address during your appointment. This is where many patients struggle. Start by asking yourself, what's changed since my last visit? Or what's been bothering me enough that I decided to make this appointment? Be specific about when symptoms started, how they feel, what makes them better or worse, and how they're affecting your daily life. Then, and this is crucial, prioritize your concerns. If you have multiple issues, decide which ones are most important to address. Most appointments simply can't cover more than 2-3 concerns effectively. I learned this lesson personally when my mother, who typically avoids doctors, finally agreed to see one. She had a list of about 8 different symptoms, from joint pain to sleep issues. but she started the appointment by talking about a minor skin rash. By the time the doctor got to her chest pain, which was the real reason I had urged her to go, there were only 3 minutes left in the appointment. The doctor had to schedule another visit, which my mother nearly canceled out of frustration. So write down your concerns, prioritize them, and start with the most important ones. And be honest, even about embarrassing symptoms. Trust me, doctors have heard it all. And what you're hesitant to mention might be the most important clue to your diagnosis. The questions you ask during your appointment can be just as important as the symptoms you report. But in the moment, with the pressure of time and the natural power dynamic between doctor and patient, it's easy to forget what you wanted to ask. Prepare your questions in advance and write them down. Focus on open-ended questions that will give you useful information. Instead of "is this normal?" try "what does this symptom typically indicate?" Instead of "is this medication good?" ask "what are the common side effects of this medication and how will we know if it's working?" Some essential questions to consider for any treatment plan. What is this treatment supposed to accomplish? How will we measure if it's working? What side effects should I watch for? Are there alternatives to this approach? What happens if we don't treat this condition? I had a patient named Alina who came to every appointment with 3 index cards. The first had her symptoms listed, the second had her questions, and the third was blank, for taking notes during our conversation. She told me it helped her feel more in control and made sure she didn't leave with unanswered questions. For senior patients especially, questions about how treatments might interact with existing conditions or medications are critically important. Don't assume your doctor has reviewed every aspect of your medical history. Be your own advocate by asking specific questions. About potential interactions. Sometimes, the most powerful preparation tool isn't something you write down. It's someone you bring along. A health advocate, whether that's a family member, friend, or professional patient advocate, can transform your medical experience. Your advocate can take notes while you focus on the conversation, help you remember details about your symptoms, ask clarifying questions you might not think of, provide emotional support during difficult discussions, help you understand information after the appointment. I witnessed the power of this firsthand when my father was diagnosed with prostate cancer. My dad is a proud man who doesn't like to make a fuss. During his first appointment alone, he came home with almost no information. He told us everything was fine despite having a cancer diagnosis. For his second appointment, my sister went with him and discovered he had a Gleason score of 8, indicating aggressive cancer that needed immediate treatment. Without her presence, he might have delayed critical care. If you're going to bring someone with you, brief them beforehand about your concerns and what role you'd like them to play. Are they there mainly for emotional support? To help ask questions. 2. Take detailed notes. Setting these expectations helps both of you get the most out of the appointment. And if you're a caregiver or family member reading this, remember that your role is to amplify the patient's voice, not replace it. Unless there are cognitive issues at play, let the patient lead the conversation while you provide support. Even with perfect preparation, the appointment itself can be challenging. Medical settings can be intimidating, conversations can move quickly, and it's easy to feel rushed or confused. First, arrive early. This gives you time to complete any paperwork, gather your thoughts, and perhaps most importantly, use the restroom. Nothing derails an appointment like an urgent bathroom need right when the doctor arrives. When your doctor enters, start with your most pressing concern. Don't save the important stuff for the end. Say something like, I have 3 issues I'd like to discuss today, but I'm most concerned about these chest pains I've been having. Take notes during the conversation or ask if you can record the discussion. Most doctors will allow recording if you explain it's for your personal reference. Studies show that patients who record their visits report greater understanding and satisfaction with their care. If you don't understand something, speak up. Try phrases like, "Could you explain that in simpler terms? I want to make sure I understand. Are you saying that? Could you draw that for me or show me a picture?" I had a patient, Robert, who would politely interrupt me whenever I used medical terminology he didn't understand. At first, I found it slightly disruptive, but it quickly improved our communication. He taught me to be a better doctor by reminding me that medical jargon isn't helpful if the patient can't understand it. And here's something few patients realize. If you feel rushed or confused during an appointment, it's completely acceptable to say, "I'm feeling a bit overwhelmed with all this information. Could we slow down?" Most doctors will respond positively to this kind of honest communication. Before you leave your appointment, make sure you clearly understand the treatment plan. This is where so many healthcare breakdowns occur. Ask your doctor to summarize the plan. What medications are you taking? What lifestyle changes should you make? What follow-up appointments do you need? What symptoms should prompt you to call or seek emergency care? If you're prescribed a new medication, make sure you understand the name of the medication, what it's for, how often to take it, how to take it, common side effects, potential interactions with your other medications, how you'll know if it's working, how long you'll likely need to take it for complex conditions. Ask if there are any patient education materials you can take home. Many medical offices have handouts that explain common conditions in patient-friendly language. I remember a patient, Margaret, who was diagnosed with heart failure. At the end of our appointment, I asked her to explain back to me how she would take her new medications and what symptoms would indicate a problem. It turned out she had completely misunderstood the dosing schedule, which could have led to serious complications. That teach-back moment allowed us to correct the misunderstanding before she left the office. For senior patients managing multiple conditions, this review step is absolutely critical. Consider asking for a printed summary of the visit, which many electronic medical record systems can generate automatically. The care you receive between appointments can be just as important as the appointment itself. Effective follow-up ensures that your treatment plan works as intended and that any problems are caught early. Create a system for tracking your symptoms and medication effects. This could be as simple as notes in a journal or as sophisticated as one of many health tracking apps. The key is consistency. Recording how you feel at regular intervals gives your doctor valuable data at your next visit. Know when and how to reach out if problems arise. Before leaving your appointment, clarify, when should you call the office with concerns? Is email communication an option? What symptoms warrant immediate attention? Who should you contact if your doctor is unavailable? I had a patient, David, who developed a rash after starting a new antibiotic. Instead of stopping the medication immediately, he waited 3 days until the rash covered most of his body, because he didn't want to bother anyone. By the time he came in, he had a severe reaction that required hospitalization. Had he called at the first sign of the rash, a simple medication change could have avoided that entire ordeal. If you're waiting on test results, don't assume no news is good news. Be proactive about following up. Many medical offices are overwhelmed with results to process, and occasionally things do fall through the cracks. A simple call saying, I had a blood test last Tuesday and was wondering if the results are available, can make all the difference. For seniors managing chronic conditions, consider keeping a dedicated health calendar that tracks appointments, medication refill dates, and scheduled tests. This simple tool can prevent gaps in care that might otherwise go unnoticed. If you're a senior patient or caring for an older adult, there are additional considerations that can significantly improve healthcare experiences. First, be aware that symptoms may present differently in older adults. For example, heart attacks may occur without chest pain, infections might not cause fever, and serious conditions might manifest only as confusion or fatigue. This makes detailed symptom reporting even more crucial. Second, medication management becomes increasingly complex with age. Seniors are more likely to experience side effects, drug interactions, and dosing issues. Before each appointment, conduct a medication review at home. Gather all prescription bottles, over-the-counter medications, and supplements check expiration dates. Note any changes in pill appearance, identify medications that need refills, write down any. Side effects you suspect. Third, consider the timing of appointments. Many seniors find their energy and cognitive clarity is best in the morning. When possible, schedule important appointments earlier in the day when both you and your doctor are likely to be fresher and more focused. My patient Helen, who is 92, always requested the first appointment of the day. She told me, "By afternoon, my brain gets foggy and I can't remember what I wanted to ask you." And honestly, doctor, I suspect you're a bit worn out by then too. She was absolutely right. Finally, don't dismiss symptoms as just aging. While some changes are indeed related to growing older, many are treatable conditions. Persistent pain, decreasing mobility, memory changes, vision or hearing loss, and changes in bladder function should all be evaluated, not just accepted as inevitable parts of aging. The most effective healthcare happens when patients and providers work as partners. This partnership doesn't happen automatically. It's built over time through communication, respect, and shared decision-making. Be honest with your healthcare team, even about things you might find embarrassing or judge yourself for. If you haven't been taking your medication as prescribed, haven't been following dietary recommendations, or have been using substances like alcohol or tobacco, your doctor needs to know. This isn't about judgment. It's about having accurate information to make good decisions. Express your preferences and values clearly. Different patients have different goals for their care. Some prioritize longevity at all costs, while others focus more on quality of life. Some are comfortable with aggressive treatments, while others prefer more conservative approaches. Your doctor can't honor your preferences if they don't know what they are. I had a patient named Frank who suffered from severe COPD. When discussing potential treatments, he told me, "Doc, I don't care if a treatment might give me an extra year if it means I can't fish with my grandkids. That's my measure of a life worth living." That clear statement of values guided our treatment decisions in a way that respected what mattered most to him. Remember that disagreement doesn't have to mean conflict. If you're uncomfortable with a recommendation, say so. Try phrases like, "I'm concerned about that approach because I've read about alternatives and I'm wondering if we could discuss. That doesn't align with my goals because." Most doctors appreciate patients who are engaged in their care, even when there's disagreement. The key is expressing your concerns respectfully while remaining open to professional expertise. Preparing for doctor visits isn't just about being organized. It's about taking an active role in your healthcare. It's about transforming what could be a rushed, confusing interaction into a productive partnership that improves your health outcomes. The strategies we've discussed Gathering your medical information, identifying and prioritizing concerns, preparing questions, bringing an advocate, navigating the appointment effectively, understanding your treatment plan, following up, addressing senior-specific needs, and building a healthcare partnership. These aren't just nice-to-haves. They're essential tools for getting the care you deserve. I've seen firsthand how patients who come prepared receive better care. Not because doctors intentionally give unprepared patients less attention, but because the healthcare system's constraints make it difficult to provide optimal care without the patient's active participation. Remember my father, who I mentioned at the beginning. After his experience, I helped him create a simple preparation system. For his appointments, his doctors now comment on how productive their visits are, and more importantly, his health has improved significantly because issues are caught earlier and addressed more effectively. You deserve healthcare that addresses your unique needs, respects your time, and honors your values. Preparation is how you get it. If you found this information helpful, please subscribe to our channel for more videos on navigating the healthcare system. And share this video with someone who might benefit from these strategies, perhaps an aging parent, a friend with a chronic condition, or anyone who feels frustrated with their healthcare experiences. In the comments below, I'd love to hear your experiences. What strategies have helped you get the most out of your doctor visits? What challenges have you faced? Your insights might help another viewer who's struggling with similar issues. Until next time, remember, in the exam room, preparation isn't just polite, it's powerful.